from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday, and Dr. Erica Stokes joins us this morning. And today we're talking about postpartum depression, baby blues, how it can affect not only new moms, but new dads too. And Dr. Stokes, thanks for taking some time out of your morning to join us and talk about this. First, let's talk about the baby blues, postpartum depression, what it is and what are some of the symptoms?
Sure. So baby blues can be anxiety, feeling overwhelmed, moments of tearfulness, anxiety, being irritable, having difficulty sleeping, but it's usually short-lived. It usually starts about 2 to 3 days after the baby is delivered and resolves within a couple of weeks typically.
Well, you mentioned 2 to 3 days after the baby is delivered is when it can typically start. That's because most of the time sleep is really at a premium for those first 2 days and then long after that. But the body, just kind of wears down without adequate sleep and these feelings start to arrive. But what are some of the things that go along with postpartum depression specifically that might be different than your typical sleep deprivation, trying to survive, especially after your first kid where you're kind of overwhelmed?
Sure. So postpartum depression, you may have a loss of interest in things that you typically were really passionate about. You may have difficulty sleeping or find that you're sleeping too much, trouble with your appetite or overeating, again, irritability, panic, anxiety, thoughts of harming yourself and or harming the baby, feeling hopeless, just a sense of hopelessness or feeling helpless as if it's something that is not short-lived and is not the same.
And affects fathers too?
Yes, so that's the interesting thing, Chris. So this can affect dads as well. So it's something to be on the lookout for. If folks are feeling more irritable, more anxious, having difficulty sleeping, we all need to ask for help and talk to our doctor.
Let's talk about when we should talk to a doctor. You mentioned the fact that one of the symptoms could be harming yourself or someone else like the baby. Obviously, that's a major red flag. But even if that's not something that someone is feeling, what are some of the bigger or the other red flags that could be big enough to where you want to talk with your doctor about it and say, this isn't just sleep deprivation taking over?
Sure. So looking at a change in function where you just really cannot function day by day. Certainly, like you mentioned, if those thoughts of harming yourself or the baby are there, that's a huge red flag. But not being able to function, not being able to focus, ask for help, and we're happy to give it.
All right, and they are happy to give it anytime at Baptist Health. You can call the Baptist Health Healthline at the information on your screen or go to baptist-health.com for more resources. Dr. Stokes, thanks again for taking some time out of your day. We'll talk with you next time.
Thank you. Stay well.